Scarborough Southwest. Today we're here with another session of our New Normal series. And today I'm very excited to have two incredible heroes of mine, I would say, two incredible powerhouses that have been leading on this fight against COVID. And I am really excited to have them here with me as we discuss this important topic of protecting Scarborough. But first, as I start this evening, I want to just take a moment and say how proud I am of our community, of your patience, of your resiliency to keep fighting this fight and to keep yourself safe, your family and our community safe. And despite the struggles that we are facing right now, I know that everyone in our community are working hard to make sure that we get through this together. So this evening, we want to have an important discussion, a holistic discussion really, on this topic of what's happening in Scarborough, because we know Scarborough has been hit the hardest. And yes, we hear this phrase a lot, but what does that really mean? So just this afternoon, I was just looking at some of the data in terms of how we have been hit, and the positivity rate is over 20% in Scarborough. And that's just one sort of figure to kind of get us started. And the goal I have this evening with my two guests are really to have a holistic discussion about what we are really, really look at the deep issues that are causing the community spread in Scarborough, why COVID-19 is hitting some of the communities like Oak Ridge, like Warden Woods. Some of the communities in Scarborough are worse than others. And then obviously share some of the stories that we've been hearing. For those of you who are joining us on Twitter, Facebook, or YouTube, make sure to send your comments, share your story, ask your questions so we can find out your experience as well on the ground. And then the second portion of tonight's session is to make sure that we understand how do we combat this and how do we focus on the solutions? What do we need to be able to make sure that the folks who are working on the ground, the folks who are protecting our workers, the folks who are leading the fight in our healthcare system, how do we make sure that they have the right tools, they have enough resources to keep fighting this fight as well? And obviously make sure that how you're all protected. So without further ado, I want to introduce our two special guests. First, I have Dr. Lisa Solomon. Dr. Solomon is an ER doctor at Scarborough Health Network and an avid patient healthcare advocate who has been working on the front lines throughout this pandemic to protect the people of Scarborough. Dr. Solomon brings firsthand experience and accounts of how our emergency rooms and hospitals are looking during COVID-19 and the dire situation our community and our frontline healthcare workers are facing. Dr. Solomon has also been actively advocating for equitable pandemic response that prioritizes Scarborough, which may have been now described as ground zero for COVID-19 in Ontario. Please welcome Dr. Solomon.
Thank you very much, Dolly, and thanks for having me here today. I'm looking forward to being able to share our experiences with the community of Scarborough, to be able to answer any questions, and to be able to share with you what's going on in Scarborough and what we need for the future to improve things for everybody who lives in Scarborough. First, I want to thank everyone who supported us, our frontline workers in the hospital over the last 10 months, all of the PPE donations and food and support and cheering and parades. I have to tell you that all of those things really just helps fuel us. We're working really hard, and some of the stories you'll hear are difficult, but your support is really appreciated. And the parades I've attended and all those things, just the smiles and the diagrams, the signs, the waving, the cheering, it really does help us, and it just brings smiles to our faces. So I just wanted to thank all of you. I also want to thank all of you for all of your hard work. What we're seeing in Scarborough is an underlying issue of our community. Many of you are essential workers, and you have to go to work. And what we're seeing is many of the people who are coming to our hospital or COVID assessment centers with COVID likely caught it at work. And so I'm going to leave it more to Deena to discuss some of those issues, but we're well aware, and we've really been also advocating, even from like a medical point of view, a healthcare point of view, in terms of sick day wages, and so that people who cannot work because they need to self-isolate or because they're sick can get the financial support that they need. So I'm well aware as a physician, everybody in the hospital is well aware. We have been advocating for that as well. I know Deena can speak much better to that than I can, but I just want to let you guys know we're aware. And we really, if there are things that are unsafe in your work situation, to please let us know, because it's really important that that you're safe. And the other thing that we know is in Scarborough, a lot of people live in multi-generational homes. So if I get the chance, I can talk about some of the opportunities in terms of self-isolation and what you can do. So again, I want to thank all of you for everything that you've been doing, and I will be happy to answer your questions and have further discussion later on.
Thank you so much, Dr. Salomon. Next, I have Deena Ladd, who is the Executive Director for Workers Action Center, a worker-based organization that is committed to improving the lives and working conditions for those facing low wage and precarious employment. And for over 2 decades, Deena has been fighting for rights of workers and advocating for change. More recently, Deena has been at the forefront of the fight for paid sick days, something that Dr. Salomon just mentioned, and something Deena has been fighting for even actually, as far as I can remember in my work that I have been doing in the labor world, even before I was an MPP. She's been advocating for change for many, many years. More recently, I think, she's also been making sure that she's keeping the government to account, working hard to make sure that we're keeping workplaces accountable during COVID-19, to prioritize health and safety of workers. Deena has also recently spoke at the powerful demonstration at Queen's Park, in front of Queen's Park, where workers staged the die-in to call for paid sick days. And it was one of the most timely demonstrations we've seen in the past few months, I think. So Deena, go ahead. Welcome.
Thanks so much, Dolly and Dr. Salomon. It's so great to be here because we're talking about the issues near and dear to our hearts, which is how we are able to protect ourselves and our families and be able to go home at night and be safe at the end of a workday. And I think, last week when the Premier announced the state of emergency and the stay-at-home orders, I was so appalled that, he was making those announcements and not introducing paid sick days. I think we were all waiting for him to say, and we're going to put in the measures and make sure that essential workers, when they go to work, have paid sick days. And there was nothing. There was absolutely nothing. And I think all of us, to use a British expression, were gobsmacked and sort of were like, just couldn't believe our ears that we were not hearing that this essential labor right protection was being put in place. And, so to me, this phrase that he keeps using, which is, stay home, saves lives, that, it has no meaning for those of us who have to go to work and who can't, and to sort of just equate and keep saying that doesn't deal with the reality that many of us have to go to work and are doing vital services in the community, whether it's a personal support worker in a long-term care home, or it's, serving us at the grocery store, or, making sure that we're getting the kinds of medicine that we need at the local pharmacy, or packaging goods at a warehouse. Like, all of these jobs are so critical to us being able to take care of our families, and people can't stay home. And so they need the kinds of paid sick days that we're talking about and that we'll talk more about tonight. We need more better jobs. We need to be able to speak up around infections, or if our employer is not doing what they should be doing, without fear of retribution. without fear of being punished that we're going to lose our jobs. Every moment that we have at work, if our job is on the line, it doesn't allow us to speak up about the issues of health and safety. That's a problem. That's a huge problem. And so I think tonight, I'm hoping that we'll get into more details about what do we need to make our workplaces safer? What do we need to make our health better, so that we can actually have access to what we need to take care of our families and to be able to go home at night. And to me, I think it's really brutal when you hear the Minister of Labour saying, I care about workers, that they get to go home at night. Well, people are not going to be able to go home at night if they don't have paid sick days and if they don't have strong labour protections. And that's what I'd like to hear from the government. And that's what we're certainly fighting for with the Workers' Action Centre and with great allies like Dolly and the Decent Work and Health Network, and all of us coming together to say, you know, enough is enough. We need to make sure that we have what it takes to be safe. So I'm going to leave it at that, and we'll talk more about sort of what we're fighting for to make sure that that we all have what we need.
Absolutely. Thank you so much. Thank you. I think we're just kind of going back to what both of you said about the fact that despite all of this, the reason why I think in the first wave, we kind of got through it and there was so much energy, and in the second wave we're still holding on, is we've got incredible organizations that are fighting really hard. We've got volunteers who have been encouraging each other, really, the smiles and the love, and they've shown as well, for all our healthcare workers, our essential workers, and then making sure that the healthcare team that we have as well, have been doing some incredible work despite the limited resources they have. We have access to care still available, and I want to first go into some of the issues that we're facing in terms of, like, talking about why is it that we are hard hit than, say, UHN or some of the other places. I mean, what is it? I mean, first, what is with the aspect of the healthcare section of it, and the idea that why do we have more community spread? And I'll pass it on to Dr. Salamon.
So first, I want to let everyone know that we're open to see you. We have 3 emergency departments in Scarborough, and we're open. There's physicians, nurses, we're well staffed, and we really, if you're sick, we want you to come. I mean, we hear all the time people say, oh, I'm scared to come. I don't want to get COVID, or I know you're really busy. I don't think I'm sick enough. But what we're seeing is a lot of really advanced presentations of both COVID and non-COVID illnesses. So unfortunately, I'm seeing the sickest people I've ever seen in my career, including things that have nothing to do with COVID, and it's sort of the repercussions of it. I've been seeing a lot of advanced cancers and diagnosing them for the first time in the emergency department. So if something's wrong that you would normally go see your family doctor for, I want to really encourage you to please see your family doctor. No matter what you're saying, family doctors are open. They're doing a combination of virtual care and in-person care. Just call them. They're available and they're there to see you. So if in the past you would have seen your family doctor, please do so. And it may even be more convenient for you now because they're available for virtual care. So even at work now, you can get medical care from your family doctor as well. Some things you have to go in, so please make an appointment, but your family doctor will help sort that out. From an emergency department point of view, if you are having symptoms that you think might be a stroke, if you're having chest pain and you think you may be having a heart attack, or if you're having shortness of breath, or abdominal pain, or you're feeling really sick that normally you would have come to the emergency department, please come. We're there for you, and we will manage you no matter what you see about how busy we are. We'll find the space and we will take care of you. We have come up with all sorts of unique options. One of our sites, we have a trailer that we're seeing patients. It's actually really nice. we're using we have surge capacity. So we are using other areas to see patients, and we're doing really our absolute best and providing the same exemplary care that we always have. Sometimes in certain circumstances, you might have to wait a little bit longer depending on how you arrive or depending what the situation is. And sometimes you're seen pretty quickly. So, we just ask for everyone's understanding and patience, but I just want to urge you to not be scared. You're not going to get COVID in the emergency department. We have so many protocols in place, and everyone's done a really excellent job. But to Dolly's question, why do we have our issues in terms of healthcare capacity? So one of the things is our infrastructure. So our hospitals are really old, right? No government for the last 20 plus years has invested in the Scarborough Hospital, or significant investments in the Scarborough hospitals. And this is nonpartisan, this goes across all parties. So we really need to now show we're in this place right now because we don't have the infrastructure we need for the population of Scarborough. We have a huge population of Scarborough, and we don't have that capacity. Two of our emergency departments, so at the Birchmount and Centenary, are way too small for the number of patients that we see. Both of them are supposed to get renovated, and they're on the list for renovations, and plans are happening, but they need to be renovated now. And we need to get, the party of the day to commit in their budget to put it on the books as number one priority. And we need, as we've talked about for a long time, we need a new hospital. So we need the government to commit to putting in their budget and make it a priority that Scarborough gets a new hospital. Our community deserves it. You guys deserve it. And really, a lot of the issues that we're seeing right now is because we're dealing with old infrastructure.
Thank you very much. This is something, and I remember after I was elected, one of the first things we did as MPP, I was visiting all the location in Scarborough. We have 3 different locations, and I was visiting all locations. And even before, this was way before COVID, in 2018, just seeing the conditions there, we needed to be able to fix things at that time. We needed to have more capacity. We needed to have more support for all of our healthcare team members, and we needed to fix the infrastructure. I think just the actual building itself, the capacity itself needed to be fixed as well. I want to go to Deena now and talk about community spread and what we're seeing in Scarborough, and how that, the reasonings behind why we have over 20% positivity rate in Scarborough. And we know there are a few causes there, and if you would highlight some of those.
Yeah, I think one of the big issues that we're dealing with is that, and it goes to all those underlying issues that have been kind of pushed to the forefront during the pandemic, which people have been sounding the alarm bells for decades. Such as, lack of investment in infrastructure so around rights in the workplace, it's been this huge rise of precarious employment, unstable, short-term, low wage, work. And so for the last 30 years, what we've seen, especially in places like Scarborough, as sort of a dominance of really bad jobs, of people having to go through temporary agencies, work through subcontractors, not being able to get stable work, and a lot of underemployment. So a lot of people not able to find a full-time job, and these were really exposed in long-term care, where you're looking at the conditions that personal support workers are working under, where women have been told, because they're predominantly women, saying that you can't work in more than one facility. Well, why is that happening? Well, it's because women are not getting the hours that they need. They are having to juggle 2 or 3 jobs. I know personal support workers who are also working in grocery stores to try and make ends meet, because they are not getting the hours, or they're not getting paid for all their work. And we've known for years that the conditions that personal support workers are dealing with have been horrendous, and that it's mainly been racialized women of color who have been doing that work, not first of all, making very low wages, the last to get health benefits, not getting paid for all their work, short-term insecure work, and certainly not having a voice in the workplace. And so one of the big things that we've been raising from the Workers' Action Center is that these same conditions that exist in long-term care are in other sectors. So when you look at grocery stores, for instance, so some of the unionized places say, well, full-time workers have health benefits and have paid sick days. But when 85% of your workers are part-time and don't get access to health benefits and paid sick days, then that's a moot point. It doesn't matter. And so those conditions that are insecure, that are short-term, low-wage work, exist in warehousing and logistics, exist in retail, in grocery store work, exist in many of the sectors that our community members work in. And Scarborough is one of those communities, just like it is in Peel. And I think that and North York. And so I think we need to recognize that the underlying bad working conditions that we're in don't allow us to have a voice when things are not going well. We know, for instance, for those of us who are working through temporary agencies, that is one of the biggest ways in which we're able to find work. Yet we know that workers, that if you're working through a temp agency, you have a higher chance of being injured on the job. You have a higher chance of basically making basic employment standards, no health benefits, becoming a permatemp, not being able to have a voice at work, knowing that your assignment can end just like that if you speak up. These are well-documented, cases. We've had years of research that have looked at precarious employment and said how bad it is for your health, and nobody has cared. And in fact, when we did make improvements in 2018, when this new government was elected, they came and they took away everything. They took away even just the 2 paid sick days that we had. They took away equal work, equal pay for equal work. They took away scheduling rights. They took away any basic improvements that had been made after like 30 years. And so we're in a situation where all of that now has come to show exactly how vulnerable people are in a workplace when a pandemic hits. And it's terrible that it's taken a pandemic to bring to light the horrendous working conditions in long-term care, in grocery stores, in retail, in all of these sectors, and that it's meant, hundreds of people dying to bring attention to this plight of workers and to residents and to the quality of care. And so I think that in order to deal with the kinds of infection rates and outbreaks that we're seeing in workplaces, we fundamentally need to deal with precarious employment and the bad working conditions that exist in so many of these workplaces that make workers so vulnerable to just hazardous conditions. And I think it's just appalling, as I said, that it's taken a pandemic for us to deal with this.
Yeah. You touched on quite a few issues, and one of them actually that we have been dealing with in our office, specifically most recently, is a lot of the workers who are dealing with COVID, but are not able to openly speak out about it. And we had the same thing in the beginning of the pandemic when we had, and I'll give one example, which was actually a workplace in Scarborough named Cosmetica, which has workers, mainly racialized women, who work there and have worked there either 5, 10, 15 years and don't have the safety and security of their job or the ability to speak out. And obviously there are many, recently a lot of them were fired in the middle of the pandemic after they were taken advantage of and had to work in the workplaces. And there's the safety concerns and the issues in terms of whether they're actually isolated, or what happens if there is a COVID case, and how are we actually protecting these workers when they need to speak out. And I think that's a huge concern as well, because we had another incident where another worker in another workplace in Scarborough Southwest, actually, where it took the media to come out and just expose what was happening in that place, just so they would have a proper cleaning done and then bring back the workers, so that no one else gets infected. And it just, there's so many bits and pieces of that, because it's not just about that worker. It's about the worker's family, it's about the community, it's about the people who go to that workplace or go to that shop, for example. It's about all the other co-workers, it's about the entire community that can now face the spread. And I was kind of livid when I heard about these, some of the well, you can't just say stay home, because we know majority of the people in Scarborough who are essential workers, they cannot stay home. But the other issue is, we also know that a lot of people who are being blamed, for example, for COVID, was people who are forced to go out and work. And that whole, there's a racial aspect to that as well. And so as and now that as we look into the idea of vaccination, for example, and look in some of the solutions, and I want to thank everyone who's joined us, because we've got some people who's joined us on 3 of our platforms. Please make sure to leave your comments and questions for both of our guests, and let's share your stories as well. But I want to go back and talk about vaccination, and how do we approach on a really equitable solution for some of the things that we're facing. You know, can we talk a little bit about what's happening with the current situation with vaccination in Scarborough right now, Dr. Salamon?
Yeah, thanks, Dolly. So I'm involved with the vaccination rollout in Scarborough right now. Unfortunately, as I'm sure everyone's heard, there's supply issues with the vaccine. I am proud of the Scarborough Health Network and all the staff there. We have developed an amazing infrastructure for vaccinating people in a very short time. So even just at our site in Centenary, we have the ability to vaccinate at least 1,000 people a day. We just don't have the vaccine for it. So we had been ramping up and working out all sorts of modeling for it. And we have that ability just at that one location. We're ready, and we have the people in the infrastructure to be able to do a max vaccination center. So one of the things that we have been advocating for, and we'd like you to advocate for, is to be the first community mass vaccination center, because we really think it's important to be able to vaccinate the vulnerable population of Scarborough. I mean, you guys have mentioned multitude of reasons why our community should be prioritized and should be number one. As you said at the beginning, Scarborough is ground zero for COVID-19 in Ontario. Our positivity rate, unfortunately, is over 20%, and our hospital system has the most patients admitted to hospital with COVID, as well as the most patients in the ICU. So it is a big deal. The way we're going to get out of this is by vaccinating our community as fast as possible. So we want to write the playbook for how to vaccinate the community, and we have it written. We know how to do it. We just need the government to basically give us the keys and give us the go-ahead to do it. We have vaccinated all our frontline workers in the hospital that have wanted to be vaccinated. We vaccinated some of the community physicians who have Scarborough Health Network privileges and who will be delivering the vaccine as we roll it out. But we want to be able to do this faster. We want to be able to vaccinate all the healthcare providers in Scarborough as well. We have, I'm very happy to say, we have vaccinated all of the long-term care in Scarborough. So I was part of that, and I went to quite a few long-term care homes, as well as my other colleagues and nurses. We went to all of the long-term care homes. I know some of them were given by others, but some of them did it themselves, but all the long-term care homes now in Scarborough have been covered, and we've also gone to many of the retirement homes. So we're really proud that we did this really like very quickly, and it really brings a lot of satisfaction and joy to be able to do that, because I know you've all heard some of the horrible situations in some of the long-term care in Scarborough that we've had. Our hospital has really, and physicians and nurses and our infectious prevention and control people and our cleaners have gone into numerous long-term care homes in Scarborough to help out when it's been identified that there's an issue both in wave 1 and wave 2. And we've also done an amazing job with our COVID assessment centers, and also have pop-ups happening in high prevalence communities. So just to go back to the vaccination strategy, it's really important. We need an equitable solution. We should be getting a larger share of vaccine, not an equal share of vaccine. And the other issue is that because we're in Toronto, we're included in Toronto public health numbers. We're not separated. So Peel is also an area that is impacted significantly and has really similar issues that we do in Scarborough. So you can almost like scratch out Scarborough, put in Peel, scratch out Peel, put in Scarborough, right? Very similar issues. But the difference is that they have their own public health unit, and so they're identified separately. Scarborough doesn't have its own public health unit, and so our numbers are lumped in with Toronto, and we really need to advocate for Toronto Public Health to break up the numbers into the old city of Toronto, in the old bureaus that we had, so that Scarborough's highlighted, and our numbers and our positivity rate, our prevalence, and our hospital numbers are specifically known to the decision makers.
I absolutely agree. I think we definitely need an equitable amount of vaccines, not equal amount of vaccines, and that is key to addressing the amount of people we need to serve when we're vaccinating. I want to go back to Deena and address some of the issues in terms of, so vaccine is one part of the solution, and actually we have quite a few comments here. Thank you everyone who's joined. Laura messaged and said, please start now to communicate, advertise, promote the information that people who get vaccinated still need to wear PPE and distance themselves afterwards. This is not common knowledge. Dr. Solomon, what happens when you are vaccinated? Do you still need to wear PPE? Do you isolate yourself? How does that work?
Absolutely. Thank you for the comment. It's so important that we still do the same measures that we're always doing. We need to wear, I wear my full PPE. We still need to keep physical distancing, wash our hands, not get together with others. So we still need to follow all the same public health measures. We actually don't know yet if you can carry the virus and pass it to others. So it's still possible. While getting vaccinated may mean you don't show symptoms, you're protected perhaps 95%, but not 100%. So we don't know the efficacy in terms of transmission of COVID-19. The hope in the long run, when everybody gets vaccinated, or the majority of people get vaccinated, is then the burden in the community is really low. So that's the goal. But until we're there, those of us who happen to be first, we need to follow all the same precautions that we are currently doing. And that is a really good point and important for everybody to understand. The other thing is, while we're talking about vaccinating, just one more point, is I know that there's a lot of vaccine hesitancy, and that might be for another day, but while people are listening, if you get the opportunity to get vaccinated, please roll up your sleeve and please get vaccinated. It is safe. The technology that's being used is technology that I learned about when I was in my undergrad back in the late 90s. So it's not new research, and people have been working extremely hard. I mean, this is science. I believe in science. I got vaccinated. My colleagues got vaccinated. And I can tell you, when it's my family's turn, I have 3 children, ages 10 to 15. When it's my family's turn, I will be the first in line for my husband, my mother, my children, my in-laws, my sister, like everybody to get vaccinated. So I really want to encourage it, and I'm happy at another time to talk more about that.
Absolutely. And I know Mahfuzul Kaisar wrote about this in terms of if the COVID-19 vaccine is equally acceptable across all ethnic communities. There's vaccine. I don't think vaccine discriminates in terms of racial backgrounds. I don't believe so. I believe in science. And as a practicing Muslim, I can tell you that I encourage all of us to get vaccinated and make sure that we protect ourselves and our communities as well. And I think Kaimraz Duki also wrote, what about payment for staff who get the virus? So that's another issue. Dr. Solomon, did you want to touch on this?
I think are they trying to refer to that this is what I think Deena is referring to about people who have to take time off work if they get the virus. I believe that's maybe Deena can speak to that point and what's available for that.
Go ahead, Deena.
Yeah, so I mean, I think that's one of the big reasons why we're pushing for paid sick days in the province. I think that it's important for people to know that there is a federal benefit, which is the Canada Recovery Sickness Benefit. But the problem with that is that you have to apply for it, and you have to, and people are not sure if they're going to get it, because you have to show that you've lost 50% of your employment that week. You have to have made $5,000. You have to then apply for it, and then hopefully you have to have a valid social insurance number, and then you get the payment maybe 4 or 5 weeks later. So that doesn't work for many of us because, first of all, we don't need a disruption in our paychecks, especially if we need every penny on that paycheck to make the rent and to take care of our families. And so that's why provincially mandated paid sick days are really critical. And so what we're pushing for, and there's a huge momentum right now, we have many, health professionals, doctors and nurses and medical officers from across Canada and different regions. We have the mayors of all the cities that are pushing for this, for provincially mandated paid sick days. And so many of us are pushing for 7 permanent job-protected paid sick days and an additional 14 under a situation where we have a pandemic. And so you need to quarantine, and you need to be able to have the ability to take a COVID test. And so what we're basically saying is that moment when you wake up and you're not feeling well, and you've got maybe a bit of a temperature, you've got maybe a sore throat, it's at that moment that someone needs to make a decision around whether or not they can afford to stay home, and whether or not they can take a day off or 2 days off to get in line to get a COVID test. And that is why provincially mandated paid sick days are so important, because they're employer paid. It's easy to get. You don't have any disruption in your wages. It's seamless, it's accessible. And that is the biggest issue that is what we're saying that workers need right now. In addition to stronger, surprise proactive inspections in workplaces, like at Cosmetica, where they're not only not giving a company 1 week's notice and telling them the exact time and date that they're coming to inspect them, but just going in and inspecting and talking to workers, not just the bosses, talking to the workers on all the different shifts, talking to the workers who are supplied by temp agencies. So I'm making sure that they have interpreters, so that if people don't speak English, that they can actually talk to them after hours to find out what the working conditions are. Going in to a pre-appointed proactive inspection and only speaking to the supervisors and management is not a robust inspection, does not have the teeth that you need to ensure that you're really accurately finding out the picture of what's happening in those workplaces. And so there's a whole bunch of new measures that need to be brought in to be able to ensure safety at work. And those are just two different tools that the province has. And actually, they can do it tomorrow if they wanted to. There's nothing stopping them. And so I just think it's appalling that they're not using the power powers that they have to be able to protect people right now, during this crisis that we're going through right now.
Yeah, absolutely. And one thing that for folks who've joined us, one thing that we have called on the government for is to bring back the legislature so that we can actually go through some of these important, bills that have already passed, just need to go through third reading, for example, things that we could legislate. And there are some things the government actually doesn't even need the legislature back. We could just make them happen, like unannounced inspections in workplaces, in long-term care homes. Like all of these things can make a huge difference in terms of the safety of many of these workers. And Deena, you've touched on the idea of workers as well. I think PSWs are a great example of people who go through temp agencies, don't have the safety and security. And right now, more than ever, we're hiring more and more agency PSWs, even though they do such amazing work. They're getting infected. We have lost PSWs at a time. Recently, I was reading about one PSW who unfortunately ended up in a homeless shelter because she couldn't keep up with her rent, and was carrying COVID, and then the homeless shelter had everyone with COVID. Now, if this isn't the sort of the model for why we are in situations like this, then
Yeah, I was just about to say that I was speaking with someone last week who works in the kitchens in a long-term care facility, and even though she's working full-time hours, she's told she's part-time, so she doesn't get access to health benefits, and she has no paid sick days, and she's making food for the residents. I mean, to me, it just is absolutely horrendous that we have, again, largely women who are doing this work, and women of color who are doing this work and who don't have the necessary protections. And I think it really is a wake-up call for all of us to organize and to support people to fight for these working conditions, and to not forget this when the pandemic ends. These conditions that have made it so that these infections go full scale and that so many people have been infected have to be dealt with. We said this after the first wave. We said, what have we learned through the first wave? How do we make sure that these things don't happen again in the second wave? And they didn't fix it. They didn't fix it. They didn't do what was supposed to happen. They didn't raise people's wages. They didn't bring in health benefits. They didn't bring in paid sick days. They didn't improve the conditions. So then in the second wave, we've had this horrendous situation happen at Tender Care, in Barrie, in all these different facilities, and they're still not fixing it. So we have to use our voice in the community and fight for what we need, because they're not doing the job that they should be doing, the current government, and we've got to make them realize that they've got to step up or leave.
Yeah, do your job. And I think that's for the Minister of Long-Term Care, Minister of Health, everyone. For myself, I mean, if I'm not doing my job, I shouldn't be there. And there we've got quite a few comments as well about different groups of people who are fighting for paid sick leave. So I want to come back to Deena again, and actually Diana McLaren, a friend of mine who joined as well, and she said that she knew Deena from years and worked with you at Ryerson. You're a firebrand, an amazing student activist at that time, and she's so glad that you're with us today. So thank you, Diana, for joining. I'm sure Deena's very happy to hear that. Diana also asked that if, in terms of effective groups, organizations, do we have big unions? And a big shout out to QP, OPSU, I think SEIU, all of them who are fighting for paid sick days. Deena, what has been your experience in terms of the level of community support organizations that are asking for this?
Well, first of all, hi, Diana. So great to see your name. Yes, we're going back a few years now. So yeah, I mean, I think that there is a growing movement where people are really coming together, many unions, but most importantly, I think it's not necessarily a labor issue anymore, which I think is really important. I think that we're seeing healthcare workers, we're seeing parents, teachers talking about the need for paid sick days so that their kids don't have to come to the classroom sick because their parents can stay home if they're sick. And so this has become an issue of, low wages, precarious work, unsafe working conditions. It really affects all of us, right? It affects all of us. And I think that one of the exciting things I've seen is teachers joining together with doctors, with nurses, with healthcare workers, and the traditional unions, public and private, and with organizations like ours that are like worker centers and that support non-unionized workers. And we've also seen faith leaders also coming out in support of decent work, which has been incredibly important. And some small businesses who are saying, I support paid sick days. I provide them to my staff because my business is not going to run without them. And so we've had, really great small business owners saying, if I can do it, why can't Walmart? Why can't Loblaws? Why can't Amazon? I'm a tiny small business, but I know what's important to keep my staff safe. And so I think we're seeing a real kind of cross-sectoral coalition and voices coming together during this pandemic to really kind of push the government. Finally now the mayors are also stepping in line as well, which has been incredibly important. But yet the government still doesn't seem to be listening. And so I think that's why I think the public really needs to step up. You need to get involved in phoning your politician, especially if they are the ones in power, and saying to them, why are we in a situation where there's no paid sick days? How can you justify this? And I think that we need to really hold them their feet to the fire and to say, if here's a moment to prove yourself. What are you doing for our community? Why are you not making sure that we get to take care of ourselves when we're at work? And so I urge everyone to be phoning the Premier, phoning the Minister of Labour, phoning the Minister of Long-Term Care, and phoning their local MPP and saying, what are you doing about this?
And I think the one thing that we have been really focused on during this time is this is beyond party politics, beyond any partisan politics. As an NDP MPP, I'm happy to work with any Scarborough MPPs who's willing to work with me to make sure that workers are safe, to make sure that we have paid sick days, make sure that PSWs, ECEs, workers who are out there every single day in our healthcare system, fighting hard against COVID, get the protection they need. Let's all come together and make sure that we solve this. Dr. Salamon, I want to go to you because we've got and thank you to those of you who are leaving your comments and questions. Dr. Salamon, I saw you, agreeing with Deena with paid sick days, and I'm sure you're seeing a lot of workers who come into the hospital as well. Are workers, not necessarily what we're seeing in other parts of the province as well. Share with us what you're seeing.
So I'm seeing the same thing. So I will see someone, particularly in the COVID assessment center when I work there, who comes in, they've either had an exposure to someone who's had COVID or they have symptoms, or I call them back after with a positive test and I give them the instructions. So if you've had an exposure to someone, you have to self-isolate for 14 days. Like, end of story, plain and simple. If you have symptoms, you have to self-isolate, and that's even just a runny nose, a sore throat, you feel kind of like, muscle aches. You have to self-isolate if your test is negative until you're symptom-free for 24 hours. If your test is positive, you have to self-isolate for 10 days from onset of symptoms. So now you can imagine the complication when you live in a multi-generational home, what your day one is. So if your child has COVID and you have to take care of them, your self-isolation actually starts the day they're done. It's really complicated. One day I had 11 people in the same family who lived together. And I was like trying to spend so much time to try to figure out when, you know, and it was obvious some of them had COVID based on their symptoms. I mean, if you lose your taste or smell, like there's nothing else that you have other than COVID. So I knew that some of them had COVID, and really trying to figure out like if they were going to be able to self-isolate, how long they had to self-isolate is quite complicating for everybody. It takes, you know, it's complicating to figure out. But one of the people in that family said, I can't take the time off. I'm not going to get paid. And my heart broke, and I was like, you know, this is why I sort of said, well, there's the, you know, the federal program, but this is something I've been advocating for, is for paid sick leave, for this exact reason, because people will also worry that they're going to lose their job. So I know someone personally whose family member had COVID. So he had to self-isolate for 14 days because it was someone who lived in his house. And he said to me, my boss said I had to come to work. And I was like, no way, I'm calling up your boss on the phone right now. Like, you cannot go to work at all. Like, this is crazy, you know? And he said, I'm worried I'm going to lose my job. Maybe not today, maybe not tomorrow, but maybe 6 months from now. It's an excuse. And hearing these stories, and this is, I'm just giving you a couple examples, I hear these stories all the time. And we need security. You know, I'm a doctor here, but this is something that's all part, you know, we deal with all parts of the human, right? Not only just like the medical part, the psychological part, and the social issues as well in the practice that we do. And so this is really important to me because we need this in order to support people to be able to stay at home. And the other thing that we haven't touched on, because there's not necessarily someone here, but it was brought up, is childcare for essential workers. So schools closed. So I got a little bit of, you know, hate comments when I went on the media saying, you know, we need to keep schools closed, because I do know that this is a huge cause of COVID and spread, right? So again, in Scarborough, there are lots of children, and they go. In fact, actually, the interesting thing is in Scarborough, I think about 40% of the children didn't go to school. They actually went to online learning right from the beginning of September. However, a lot of people rely on school for childcare, and we know that some schools in Scarborough actually had, you know, quite a few cases and were actually closed throughout before Christmas, before the break. And as well, we also know that some of the ministry guidelines in terms of who should get tested were really confusing. I mean, I did not agree with them. Oh, if you have a runny nose and gets better, you don't have to get tested. Well, I can tell you, I see people with like really mild symptoms, runny noses, who test positive. So people rely on school for childcare, and we're sending their children if they had like a mild symptom or if it got better really quickly. And I see all the time, by the time I call someone back to say that they're positive for COVID, they're like, but I don't have any symptoms anymore. I'm fine. I want to go, you know, back to work or back to school. So we need to have publicly funded childcare right now for essential workers. Because again, we've talked about how this disproportionately affects racialized communities, but in particular, racialized women. Right, the people we're talking about right now who don't get sick days, who are being paid minimum wage, right? Like now they're the ones who's going to take care of their children. And so, I mean, these are all factors. And so I just wanted to add that piece because we hadn't talked about that. But this is something else that's really important to advocate for. I don't feel that school's safe to be open right now for a multitude of reasons, and we don't need to go into that. It is lots of children. We've seen the spike in the number of cases of children 10 to 19 who are positive. And we now know from a scientific, it's seemingly that prolonged exposure with poor ventilation is a huge risk for transmitting COVID. So in the schools, we know that that in public schools, a lot of public schools, they're not 2 meters apart. They still have large size of classes. Yes, for most of the grades, they had mandatory masking, but you know, kids, right? Like there's always an exception of a kid who doesn't, or kids pull it down, or they're outside playing together, they're eating their lunch. But spending a day in class together, so you're spending 6-7 hours in poorly ventilated schools was, again, we're going to talk about infrastructure, right? And some classrooms don't even have windows. And my sister's a teacher, and she's going to get mad at me again for saying this publicly. She doesn't have windows in her school. She did nothing but go to school, and she got COVID from school. Fortunately, she had mild symptoms, so she's fine, and she was fine. This was before the break, but her school ended up being shut down a few days later because there were a few cases in her school. And her last day of school, before she got symptoms, half her class was gone. They were away, and so presumably they were away because they had symptoms of some sort and may or may not have got tested because it's not mandatory. So, right now, while the community prevalence is high, schools can't be open. I mean, I want schools to be open. I have 3 children myself. I want them to be open when it's a safe thing to do and when the community prevalence is lower. And again, it needed to be the last thing closed, but there's still things that can be done in the community if we're going to really talk about that we're in a lockdown. I mean, prior to recently, the stay-at-home orders, we weren't really in a lockdown. We were in a, I don't know, like
nobody seems to know.
Nobody knows really what we were doing. There was no enforcement. It was sort of like recommendations, wait until December 20. It wasn't really. And so I feel very badly for the small business owners and all the people who had to close, which I supported that they had to close, but it needed to be all done at once. Things had to be enforced. And even now it's important in terms of like enforcing these restrictions, but also paying for paid sick leave and childcare for essential workers. Like, it needs to be done as the package. If we're going to make this work and we're going to try to make this as a short time as possible, you need all these pieces. And so I really wish that that the government would listen to what we're all advocating. And again, like Deena said, this crosses all sorts of groups, right? Physicians, nurses, advocacy groups, unions, teachers. Like, this is one of the things where I really say, and I'm all been for unity for multitudes of things. And this is really a unified approach, and we just all need to work together in collaboration to get all these pieces put together in order to make life safe for us, and in order to get back to our normal lives and back to where we want to be as quickly as possible.
Yeah, and I think people have been extremely patient as well as we get through it, and now they're getting to a point where they're like the COVID fatigue that many are calling it. And as the critic for early learning and childcare, I have to, I have to mention. I think I would be remiss if I didn't say this. From the beginning, we noticed that emergency childcare was essential, especially as more than 50% of the workforce is women. If they're going to go back to work, and when you're working at home, you're still working, you still need to make sure that your child is taken care of. Sitting in front of the TV for 5 hours does not work. It is mentally unhealthy for the child as well. And I think that piece of the puzzle was missing. And then when we did get emergency childcare, after we pushed for it, a lot of advocates, a lot of the coalition, for example, a lot of healthcare workers pushed for it. It didn't know the second wave that all of the lessons we learned kind of got dropped. And it's really important that we learn from the first wave and we use those pieces to actually do better. There's also the fact that if we don't have for safe schools, for example, we had so many schools shut down in Scarborough, so many, just one after another. And that's because, and that was, I think, the things that people called for was, we have to have better ventilation. And you cannot just give, the few $100s to get a ventilation installed if the actual vent, for example, doesn't work, or if they don't have the ability to install it, or if they don't have a proper infrastructure in the room to have enough kids. All of those pieces are very important. Class sizes was a huge factor as well. We needed to make sure we have smaller class sizes so that you can actually isolate in the space. So that you can actually have safe reopening of schools. And that's what we're advocating for. We got a few comments as well, which were about different types of vaccines, and then in terms of a lot of people who are worried about how do we make sure that we are if we're focusing on some of the pieces of lessons we learned from the previous pandemic, as well as in the community when we talk about protecting workers. Are there ways that we can actually, encourage people to how do we help people who are right now stuck in these workplaces, and what can they do? And I know from my office, for those of you who are watching, if you want to anonymously come and share your story, let us know what you're facing in your workplace, please do. We will make sure that we protect your identity and let the Electoral Public Health know so they can go and do an inspection. And Dr. Salamon touched on another point, which was about multi-generational homes, something very common in Scarborough. As a brown woman, I know that it's very common for us to live with, our dada, nana, dadi, ma, baba, like our parents basically, and our grandparents, you all live together. This is a very common thing, and that means you have 11 people who get infected when one person gets infected. But that's not to blame the multi-generational structure for homes. In fact, it's a great thing because then you have your whole family together. But to make sure that you protect the one person, the two people who actually have to go out and work. I want to pass it on to either one of you, because I know there's a few things that people have commented on, which are about, well, we can first go into the idea of vaccines. So someone actually talked about, if there is a difference in terms of vaccines and how do we kind of create, people who are concerned about or reacting badly to vaccines. If that's one piece, and I also want to talk about the workers piece as well. So maybe I'll pass on to, actually, I'll go to Deena first, and then I'll come back to Dr. Salamon.
Yeah, so I think so for those of you who don't know, the Workers Action Center has an emergency hotline that's open every day, Monday to Friday from 12 to 5. And the phone number is 416-531-0778. That's 416-531-0778. We also have a website, which is basically workersactioncenter.org. But the main thing I wanted to say is that, when we're in a situation where we can't afford to lose our jobs, right? That is the primary concern, especially we're in a situation where we have mass unemployment right now, and so many people have lost their work. And so we're very afraid of losing what we have. So I think the first thing is to just reach out and get some support and get some advice. And so, we are dealing with many calls from workers on our hotline around, I've been told I have to, I think there may have been someone who came to work who has COVID. What do I do? Should I get tested? All of these kinds of things, dilemmas that are happening to all of us. Or, how do I get access to to any benefits? Or how do I get employment insurance if I'm not sure about, whether or not to go to work? And so, so we'll help you through that, right? We'll help answer your question. We'll help try and figure that out, because we know for many of us, we can't afford to lose our jobs. So I think the biggest thing I can say is just get some support, get some advice, talk about it with someone. All of your calls are confidential. It's anonymous. Nobody will find out whether you've called us or not. And then we can try and figure out, at least you have someone then to sort of help you figure out what to do. There's no easy answers to this, because at the end of the day, our labor laws are really weak and don't protect us, and we have no paid sick days. So, you're trying to navigate a workplace without some of those basic safety standards in place, which means that, if you have to choose between going to work and making sure you've got a roof over your head, like, we know what you're going to do. You're going to choose the roof over your head. And that's an absolutely important decision that you have to make for your family. But maybe we can help you strategize around ways to handle it. We can also phone the Ministry of Labor and report your employer confidentially. We can also call public health and talk to them about whatever situation is happening at work if you can't do that. So we can help be your advocate, and we can help you try and figure some of that out. But as I said, there's no easy answers to any of this because of how bad the labor laws are right now. So it's important to just get some support.
Thank you so much. Salamon?
Sorry. So yeah, about the vaccine, I guess the question was asking, currently we have approval in Canada for 2 vaccines. One's by the company Moderna and the other one is Pfizer. They're pretty similar in terms of efficacy and in terms of side effects. Right now, at the vaccine center, so the hospital vaccine centers, we're giving out Pfizer. The reason for that is because of the storage requirements. They need to be stored in a -70 freezer. And don't worry, you could thaw it, and by the time it goes into you, it's like room temperature. So it's all good. That's just a back end sort of issue in terms of storage. Moderna is a little bit more flexible in that we can sort of move it. It doesn't have the same storage requirements. And so for long-term care and for when we're doing like pop-ups and taking it to different places, we're using Moderna because of the ability to transport it. And the Moderna is going to be the one that goes to Northern Ontario as well. In terms of, if you go to the vaccination centers right now, it's Pfizer. Really, from efficacy point of view, is pretty similar. From a side effect profile, they're really safe. And there's, most of us after the first dose didn't get too many side effects. The most common are muscle aches, soreness in your shoulder, fatigue, sometimes a low-grade fever, which lasts about 24 hours, which you can take, Tylenol for, or headaches. And same thing with the Moderna vaccine from what we've been seeing as well. The second dose, we have been seeing a little bit more commonly those reactions. So like flu-like symptoms, which again lasts about 18 to 24 hours. But you know what? Like I had chills that night of my second dose, and it sort of was like, okay, it's working, So I think most of us are like, we understand, we just got the vaccine. And then within about 18 hours, I was fine as well. In terms of the elderly, we hope they mount an immune response, because as you get older, if you have underlying medical issues, you may not mount to the same immune response as someone who's younger and healthier. So I have not seen, and I gave, I was part of groups that gave like probably over 1,000 elderly people at long-term care the vaccine, and we haven't heard of any significant reactions. There have been publicized from the UK what we call anaphylaxis, and so that is a severe allergic reaction. I believe the last I read, out of the millions of doses that have been given, there are about 5 or 6 anaphylactic reactions, which happens with any vaccine. So with any vaccine, the flu vaccine, any of our childhood vaccines that we give, there's always very rare, like 1 in a million or maybe 1 in a few 100,000 chances of a serious complicated reaction. Same thing with medications, but that is so minute. And so when you weigh the risks and benefits, the benefits far outweigh like multiple folds the very extraordinary rare allergic reaction. And the advantage of having physicians present doesn't have to be only us. We're a team, which is amazing, like nurses, pharmacists, physicians, like all of us together. But for us in Scarborough, we have currently at least one emergency physician wherever we go to vaccinate, for that exact reason, because we're trained to deal with these reactions, right? We're trained to assess the patients. If by rare chance there's an anaphylactic reaction, we have kits with us, and we know it's what we do all the time. We know how to manage them. So personally, in my group, we haven't had anything significant that we haven't been able to manage immediately. So it's very, very, very safe. It's, we're really hopeful based on the studies that there will be significant protection once we have this like mass vaccination, the whole community is vaccinated. And that's why, like I said before, I've been strongly advocated, as has our administration and everyone in our hospital, for us to get, the first pilot community vaccination site, so that we can vaccinate all the people in Scarborough. And I really want to encourage you. I know there's some hesitancy with people who've been offered it. We've been very successful with getting a lot of the workers in long-term care vaccinated. And I know there's some people, who don't trust government and don't trust decision makers. But I hope you can listen to me and Dolly and Deena when we say, like, this is really, really important for your health, for your well-being, for your family, for your safety, for the community. And I really want to encourage you, feel free to reach out to me if you have any questions. I'm happy to discuss the safety of vaccine. If you prefer to speak to someone, from your own community, there are physicians and nurses that I work with in all, like in various, cultural and ethnic communities who are working to get the message out. And I'm happy to connect you with people who might speak your language or who are from your culture if you're not sure. So whatever you need, we really want to give you the information and the education that you need.
Thank you so much. That's I know that that answers quite a few questions that some folks have asked. Ralph Heath also talked about, are we looking to open a public vaccination clinic in Scarborough? And I think the mass vaccination strategy that you have mentioned is going to be really, really important for that. And I can let everyone know that I will be I will be pushing for that as well, and just doing my part in helping the Scarborough Health Network and making sure that they have enough support so that we can actually get that done in Scarborough. I do want to go also into some of the folks who have joined. Paul has joined and said, did I hear right, 20% positivity rate? Once again, we are facing more than 20% positivity rate in Scarborough. We also have Reza Mikalai, who joined and said, this is very constructive and he's learned a lot of important insights here. We have Sidkur Rahman, who joined and is thanking us for doing this. Shokot Ali Shagor, who's also joined us, Zakir Hussain, as well as Diane Dyson, who joined us. Diane is another advocate who's been fighting hard in the East End of Toronto and actually Toronto-wide, and she has asked that she's commented and said, work conditions are core. The management and union at the neighborhood group have worked closely together to protect staff. For instance, people with COVID exposure are not docked sick time. So far, not one tenant in our supportive housing has tested positive, which is a great example, I think, that Diane's giving us. She also goes on to say, we are now jointly working on a campaign to ensure PSWs get a permanent pay increase. Decent work is tied to health, and health is decent work. Couldn't agree more, and I think all of us here agree. Deena, did you want to comment on that? I saw that you were, I think you agree on that. Laura made a few other comments as well and talked about hopefully seniors do mount immune response and maybe they will need after testing to see. I agree with Laura. So there's lots of folks who have joined us throughout and have commented as well and appreciated the work that we're doing. As we kind of wrap up the discussion, I do want to point out the fact that there is a lot of solutions out there that we have discussed today, and they could be implemented tomorrow, and they can prevent the spread, they can protect lives, and that is the main goal of tonight. And I hope that people got some really important information out of tonight. There are some anxiety in terms of who will get vaccines when, and I think Dr. Salamon addressed a lot of the concerns and also highlighted how there are some categories of folks who are already getting the vaccines. I know the second dosage have also started in Scarborough as well. And hopefully, in terms of the general public, if we have the mass vaccination happening, the general public in Scarborough will be able to get that. And there are also people who are worried because of they're dealing with disabilities, for example, people who have mobility issues, people who feel that they're bedridden, or people who are bedridden, or have special needs children who are, for example, stuck home. And are not able to get the support or the education they need because of different needs, but at the same time now they're that the scare of COVID are all intersecting with each other, and that has caused a lot of problems. I think we have highlighted some of the solutions, and that piece is covered in that as well. If I didn't cover any of the questions that people have raised today, I promise I will try my best to go and comment on that. Also, the information that Deena gave in terms of the phone number and the email address and the website, we will make sure that we share that on our post as well. So I do want to wrap up because I've taken a lot of time from our guest tonight, and just give you a chance to make some concluding remarks. So I'll go to. Did I? You can hear me, right?
You muted.
Okay, perfect.
So you muted. You muted at the end of it. At the end, you muted yourself. Yeah. Okay. Yeah. So thank you so much for having me, Dolly and Deena. It was really unbelievable listening to you and your advocacy. So thank you so much, and I look forward to working with both of you going forward. And just for everyone here, I'll just reiterate a few points. So one, please come and seek medical care when you're sick, be it your family doctor or the emergency department. We're here to treat you and every aspect. So I want to assure you it's safe. And we've got 3 hospitals in Scarborough. We're open and we want you to come when we're sick. We don't want to see people waiting until they're extraordinarily sick, until, we have to do resuscitations, or I don't want to be diagnosing advanced cancers anymore. So please, please, please seek medical care. Everyone's open to treat you. Please come to our COVID assessment centers if you think you've been exposed to COVID or if you have any symptoms. We have 3 sites in Scarborough, one of them actually at the general campus. It's in the general campus. If you have symptoms and you want to see a doctor, there's a doctor there, and you can make an appointment online on the website, or there's a phone number if you don't have online access. And then we also have 2 other sites where you could get tested, and again, you can get an appointment online. And we also have pop-ups available, and this week I believe we have 3 pop-ups tomorrow, Wednesday, and Thursday in the high prevalence areas to make it convenient. So if the website for our hospital is www.shn.ca. All the information is there for our regular COVID assessment centers and for our cold, flu, and COVID clinic, where you'll be assessed by a physician. You can make an appointment for those. The pop-up clinics are just walk-in, so just show up in the hours that are posted. I believe our COVID assessment center hours and the cold, flu, and COVID clinic are about 8 to 7. I could double check on the website. The pop-ups are listed on our website, and often it's on social media as well. And finally, please, I know it's really difficult, but if you have contact with someone or you have symptoms, please try to self-isolate. We've discussed all the issues in terms of not going to work, and we're obviously advocating for that, but in your home as well. If you have to, in your home, if you have the ability to stay in a separate room, that's the way to self-isolate. But if not, there are hotels that are paid for by the government. I'm not sure which government, but it's paid for. It's free for people who have to self-isolate. You need to get the information from Toronto Public Health, because they're confidential locations. So if you find out that you're positive for COVID, a public health officer will call you. Sometimes it takes a couple of days, and you'll hear from us first, but you can call them, and if you find out from one of the SHN physicians first that you're positive, then call public health. The numbers on the sheet that we give you, and ask them to help you arrange to self-isolate at one of these safe places. They're really nice accommodation. I believe they give you food and everything else that you need, because they want you to stay in your room and isolate. So if, like I said, if you have any questions or anything, please let Dolly know and she'll forward to them.
Thank you so much, Dr. Salamon. Deena, can I ask you to make some concluding remarks as well?
Yeah, I'll be brief, just because I think Dr. Salamon and Dolly have covered a lot of the information. I guess I just wanted to say, just call and get some support. I think, and then I guess the final thing is that, we're not going to get paid sick days by not fighting for them. We have to fight for them. We have to fight for all of the kinds of resources that our communities need, especially like Scarborough, right? Otherwise, we're always invisible. Our communities are invisible, and we're ignored if we don't speak up. And so it's so critical that you get involved in the fight for paid sick days and for equitable vaccinations, and for resources for healthcare and for stronger labor laws. It's not just going to happen because it's the right thing to do. We know it's the right thing to do, yet the provincial government right now is not doing it, and they have the ability to do it. Tomorrow night, Tuesday night, 15 and Fairness, which is a campaign that has been really pushing for paid sick days. So it's 15 and Fairness. They have an organizing meeting for paid sick days tomorrow night. There's over 100 people going to that meeting to push and to do organized phone zaps and to organize ways to get our voices louder and clearer on this issue. So please join us tomorrow night. And as I said, join us in this fight to make sure our communities and our families are safe, because without a big fight, we're not going to get what we need. And we've got to do it. And we don't have a choice. So please join us in the struggle. Thank you.
Thank you so much. Thank you very, very much. You both have highlighted so many different important issues, talked about solutions, and the work that you do, both of you. I'm so, so proud of the work that you do, and I'm so honored to be working with both of you. Folks who joined us, thank you so much for your time, for always tuning in to our new normal sessions. You've heard it. I think paid sick days is a must right now, something that we can make it happen. I just cannot emphasize enough the importance of it. Workplace safety, talking about unannounced inspections, talking about all of this. I hope you'll join Deena tomorrow. We will make sure that we put some of the information up on our post once again, and the details that Dr. Salomon shared as well. We'll put that on our post so that you can have all the resources available to you, accessible to you. Once again, thank you, everyone. Thank you for tuning in tonight, and thank you for everything that you're doing to make sure that our community is safe and keeping yourself healthy. Listen to the guidelines, protect yourself, wash your hands, wear a mask. Don't go out if you don't have to, and keep doing what you're doing. I'm so proud to be representing such an incredible riding of Scarborough Southwest. Stay well, good night, and I will see you next time with another session. Take care. Bye, everyone. And thank you